Good afternoon. And while these crises have caused real damage, I explained how it will cost more, hundreds of billions of dollars more, to undo the harm. That the required deficit spending, as the original plans have as well. I also talked about our seriousness of purpose, our clear plan. We're up to between 3,000 and 4,000 deaths per day. I know the pain that so many of you experience. Starting by sitting down for breakfast this morning and staring at an empty chair. The process of establishing priority groups is driven by science. We also have to continue vaccinating frontline essential workers like educators, first responders, grocery store workers, etc. But it will mean that vaccines become available. As they become available, will reach more people who need them. Think of the places that are convenient and accessible. Think of the people that we deploy in natural disasters. Experts from the Federal Emergency Management Agency, from FEMA, our Public Health Service Commission Corps, as well as supplies like dry ice and laptops and protective equipment. We're going to fully activate the pharmacies across the country. Millions of Americans. We're going to immediately start new major effort. This program will expand beyond access in neighborhoods across the country, so that you can make an appointment and get your shot, conveniently show up on a particular time, from the tubes and syringes to protective equipment. And I've already asked the team, and we have identified the suppliers who are prepared to work with our teams, and we're going to work with their teams. Not someday we're going to go do this. When I say we're going to invoke the Defense Production Act, I said, go out, even though we don't have the authority now. But let me be clear. We are not changing the FDA's recommendation and its recommended dosing schedules. So we're not doing away with that availability. With the Center for Disease Control, the National Institute of Health, of the disproportionate impact this virus has had on Black, Latinos, and Native American people, who are being infected about 4 times the rate of white Americans and dying at nearly 3 times the rate of white Americans. And the Vice President and I commit to making sure communities of color, we need funding from Congress. There will be stumbles for federal workers and federal property. We'll also be working with mayors and governors in red states and blue states and ask them to require masking up in their cities and their states. Quite frankly, it was shocking. And avoid indoor gatherings with people outside your own household. The only way we come through this is if we come through together as Americans, fellow Americans, and as the United States of America. Thank you.